today I'm going to be doing your assessment for your chest, your lungs, your heart, and your abdomen. I'm going to start with your chest and your lungs. Just a few questions to start us off. Have you had any problems with coughing? Any history of chest problems? Any pneumonia or anything of that sort?
No.
Any difficulty with swallowing or anything like that? No.
Nope.
Hard time breathing?
Nope.
Great. Okay. Just to start us off, I'm going to check the symmetry of your chest as you're breathing on the front and the back. So just sit up straight for me. Yep, hands to your side. And just take a deep breath in. Alright, very good. And on the back, take a deep breath and breathe again. Very good. Expand symmetrically. I'm going to, here, just check that there's no tugging. Here's a swallow for me. Very good. It's midline. No problem. Great. Go ahead and listen to your lung sounds in all of your lung fields. I'm going to start in the back and then make my way up to the front. So what you're going to do is just take a deep breath for me on each spot, and then we will go from there. Alright, take a deep breath. Take a deep breath. Take a deep breath. Again. Again. And again. Very good. All clear lung sounds now in the front. Alright, very good. All clear lung sounds. That sounds really good. Next, I'm going to check for your heart.
I have one.
Great. I'm glad you do. Do you have any family history of heart problems? Have you yourself had any heart problems?
No.
Very good. Any history of hypertension or high blood pressure?
What's hypertension?
High blood pressure.
I don't think so. Maybe my dad.
You yourself, though? Okay. Any history of heart murmurs? Okay. I'm going to take a listen myself, and then I'll feel around to check your heart size approximately and find the point of maximal impulse, and we'll go from there. So just a few heart sounds.
You need to lay down?
No, you can sit.
Okay.
And I'm going to time it right here. Very good. So your heart rate's about 68, which normal is 60 to 100, so that's very good. I'm going to have you lay back while I find the point of maximal impulse. At the fifth intercostal space, 4 centimeters lateral. And then I'm going to compare this. Find finding with your carotid pulse? Very good. Alright, you can sit up again for me. Alright, so your heart rate and heart sounds were good. There were no murmurs or extra heart sounds, just normal S1, S2. I'm going to now check your pulses, carotid, your radial in your wrist, and then in your feet. So here, just checking them bilaterally to make sure they're even. They're equal bilateral, I'm about +2, which is great, in your wrist. Very good, equal bilateral. Then your feet, we'll try the dorsalis pedis first, so that's the top of your feet. Here. Good, and then post-tibial. Very good. And then in your extremities, I'm just going to note for any clubbing or any swelling or cyanosis, which is blueness. There's none noted. Have you had any difficulty with any of those things?
I don't think so.
Any varicosities of your veins or anything like that?
What's that?
Veins, like varicosity veins, where your veins from the deep are coming to the surface. Okay. And that would be good. Let me take your blood pressure while you're sitting here. Alright, so it's going to get kind of tight here for a second. But just turn your arm this way for me. Alright. Very good. It was 105. Very good.
Is that good?
Healthy is 120 over 80, so that's very good. Alright, so now we are going to do your check on your abdomen. I just need you, we're going to have you get lay flat. And questions for this section, have you had any bowel changes, any nausea, vomiting, any pain in your stomach, any bloating or anything different in that way?
No.
Okay, great. As I'm looking at your abdomen, I don't see any distension or anything like that. So we will go ahead and go on. I'm going to listen to all four quadrants of your bowel sounds, and then I'm going to palpate, make sure there's no tenderness noted, and then also do some percussion on the organs around, see if I can feel like your liver border, and make sure your spleen's not enlarged. So I'll just go ahead and listen. sounds. They sounded just fine, very regular. So next I'm going to go ahead and palpate and let me know if there's any tenderness felt. Anything?
What are you feeling for?
Just any tenderness, because there's a lot of organs in here, so if there's something tender, then we need to investigate farther. Alright, so over here is your liver. Your liver's on this side, so we're going to sorry. And yours bleeding, you should not be able to feel yours bleed. Any pain or anything notice?
No, it's tickles.
Okay, I'm sorry about that. If you can sit up for me, there's one more part to our exam. We're going to do the breast examination.
I don't have those.
Just sit up for me. I'm going to. Have you noticed any like nipple discharge or any pain or masses in your breasts or in the tissue in your
Pecs?
Yeah, in your
No.
pecs. Okay. So I'm just gonna feel myself around, and then I'll feel for your lymph nodes in your axillary area. So let me know if there's any pain. Soft tissue. There's no masses. No. Put your arms out to the side if you everything are equal color and size. Any pain to these lymph nodes? Okay. Very good. Any questions for me?
No.
Alright, sounds good. Thank you so much for letting me do this assessment. And let me know if you have any questions.
Alright, thank you.